Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. Today's topic is seller suffers traumatic brain event. Stop working immediately. We'll go over the sequence of events, what happened there. Kind of a sad story. Now, as you know, we have 10 employees. We're in over 20 states around the country and are available to you 363 days a year. Our phone number is 201-663-0935. Our website is dentalpracticeguide.com. or nationwidedentalpracticebrokers.com. So call us, even if you just want to chat. We'll have a talk with you. Everything you're about to hear is for entertainment purposes only. Now, I was a dentist for 25 years, and now, for 14 years, I've been doing the dental practice brokerage nationwide. And I really enjoy it. I have no plans on retiring. Now we're giving seminars at sea. I just returned from Australia. That was fantastic. We'll have more coming up soon. I think the next one is January 6, 2025. So join us for that. Now, as we say, this information is only for entertainment. You have to use an attorney or a banker if you want further information. We are also helping you as a seller to sell your practice to some of the DSO companies out there, dental services organizations, because we work closely with them. They will often pay our commission. So if we engage a DSO, there'll be no commission to you. And also, on top of that, when you work with us, based on certain criteria, there will be no, there'll be no legal fees. That is, we reimburse your legal fees at closing. So legal fee reimbursement upon successful closing, based on certain criteria, of course, and that works out great too. So what is today's story? It's a very sad story. It happened last Tuesday. I get a call, and the doctor's staff called me and said, "Doctor stopped working." I think it was today or the day before. Just stopped working immediately. He had some kind of brain trauma as he was at the chair treating patients. Had to stop immediately. Couldn't work anymore. And they're now calling me. They've been informed that the doctor is not going back to work, is not capable of working as a dentist again. It is stopped immediately. So they're asking for my help, and we're here to help. But this is the challenging part. The doctor's hardly able to communicate. We have to get all of the records, that is the tax returns, profit and loss, procedure code analysis. Staff are nervous because they think they're not going to have a job. You've got to hold all this together. This is why we're advocates of trying to sell your practice before you're ready to sell it. If you have some level of financial security, obviously you'd have to talk to your professionals about this, your attorney, your accountants, but getting out just somewhat early. Now, this doctor was more of a senior doctor, but not too old. And they had this brain event. They can't function anymore. Now, what we've got to do is we've got to market it. We've got to advertise it. We've got to gather all the data up. We've got to get them a dental attorney. We've got to evaluate the practice. And this is typical what happens now, because the staff called me. Then we called back and forth to each other. I told them I really need to help out wherever I can. And I haven't heard from now in a week and a half. It's always the same pattern. They go into this freeze, I guess you'd call it, where nobody gets anything done. And we're losing valuable time. I don't have a copy of the lease. I don't know if I get a buyer to take over the lease. And the practice is doing over $1 million. But now, who knows what it's worth? That could have been used for the doctor's estate. So these are the problems we're encountering. So I have all this data I need. I've got to set up attorneys and everything for that. Do we have a guardian? I think the doctor was married, whatever. And what are what are these guardians can control? I don't know if they had a power of attorney if something like this happened. All of this could prevent it if the doctor get out a little earlier, a few years earlier. When? It's hard to tell. I realize some people don't have the financials to get out right now. But then they hold on, and look what happens now, because the whole value of the practice is going to plummet. You may lose staff, patients, everything. Everything can plummet now. And so the idea is we have our hands full here. Typically, these families, they don't call us for a week, week and a half. I haven't heard from them. And we've already lost a week and a half of time. Now, this is critical time. You should be gathering your data. You should be talking to the attorney. You should be reassuring the patient that somebody else is coming in, hopefully. What's going to happen? Because this practice is going to go down to zero now. How do you find it? Even finding a buyer in crisis situations is not easy. And this happened to be a specialty practice. So this is going to be a very tough practice to sell, and time is of the essence. You've got to do something right now. So for those of you, and I see what their family's going through, you get this gap of non-communication. It happens every time I get one of these crises. There's a gap in communication that I don't hear anything for a week to 2 weeks, sometimes 3 weeks. Meanwhile, the value of the practice is plummeting. Everybody's scrambling. I don't know what's happening to staff. So this is what the future holds. For those of you that can figure, just hang in there a few more years. I'll be okay, because the last 35 or 40 years were fine. I had no problems. That will predict, therefore, the future. Well, the future didn't work here. This was some kind of brain trauma that happened, and they just had to put the handpiece down. They weren't hitting the head or anything, but some trauma occurred. And it led to this doctor stopping work that day, put the handpiece down, and is never going back. So there are some problems that we've got to deal with here. Families that don't communicate right away. It is trouble for everybody. I can assure you that. It's trouble for the staff. It's trouble for the patients. I mean, it is going to be a nightmare, this whole situation. And what I'm trying to tell you is you got to get on top of these things right away. You can't wait. The best part would have been the doctor sold 2-3 years ago. I realize you can't time everything, but this is what you're up against, and we're going to do the best we can. We have many more of these videos coming out. Listen to YouTube. We just got back from the Australian cruise a few weeks ago, and we're still catching up, frankly. Luckily, my staff took care of the phone, and I had the internet on the cruise ship, so I was able to keep touch base, because my team, we never shut down. We are always here for you. So sign up and subscribe, and you'll be getting all the new updates and videos. I'm doing a bunch now to catch up. Thank you. Bye now.